Good morning and welcome to ICUS Bubble TV. I'm Linda Feinstein, and today I have the pleasure of speaking with Dr. Arnaldo Rabashovsky from Rio de Janeiro, Brazil. Doctor, you've been at the forefront of contrast-enhanced ultrasound for many years. Can you please tell us a little bit about yourself and a little bit about your work in this field?
Yes, thank you, Linda. It's a great honor to be here and to participate in this interview. My name is Arnaldo Rabashovsky. I was born in Brazil, Rio de Janeiro, and I've been working with the microbubbles for many years. The first time I knew about the microbubbles was during the 90s, when I was involved in intraoperative echo, and I saw a paper showing how can you assess the perfusion during the cardiac surgery with the microbubbles. The first time I had interest in bubbles. And in my country, we restarted to use the microbubbles in 2014 with the help of Steve Feist, my great friend, and we are using a lot in my hospital.
Tell us when you use the microbubble contrast agents.
I think the necessity to use the contrast is around 40%. I encourage my fellows to use it, and I think we use most in the intensive care unit, in difficult exams, and patients with the myocardial or with the hypertrophic obstructive cardiomyopathies, in patients to assess the left ventricular function, to assess the wall motion abnormalities, and also to assess the perfusion.
Yes. And are there some of those patients, some of those indications that you would image with alternative types of imaging if you didn't have contrast? And how does the enhancing agent help you not have to use those additional types of imaging?
Linda, I have a bias. As I am an echocardiographer, I have a bias. I think the contrast can show all the diagnosis that you are looking for. And but there is a great tendency to the cardiologists to ask for other nuclear magnetic resonance and tomography. Of course, they are complementary to each other, but in many situations the contrast is sufficient to help the patient.
So the contrast ultrasound in many cases is sufficient imaging to give you all the information that you need without additional diagnostic testing?
Yes, that's what I'm completely sure. And what it's amazing, that when the cardiologists see the image, they get surprised. They don't know, they don't have an idea in my hospital how the contrast is important, and they get surprised. And my fellows, they love it. When they get the image, I was not seeing anything. After I gave the contrast, I saw all the left ventricle, and we could access the left ventricular function perfectly. So it's a great tool, I'm sure.
Tell me about the point of view of the patient. Do the patients appreciate the ultrasound enhancing agent?
I have no problem. Usually I have no problem. I have very well-trained nurses. Mm-hmm. And when I ask, the insurance in my country usually pay for the contrast. I have no problem with that. And my nurses are very well-trained, and I usually say to the patient, we need to do a complementation with the contrast to give the right diagnosis. And usually I have no problem, and it is in my lab. It's fast to get to the contrast, to the ultrasound enhancing agent. That the way we prefer to say to the patient, because the contrast they think about something toxic as using in the tomography and in the cath lab. So I usually say that it is an ultrasound enhancing agent instead of contrast.
Interesting. And the patients are comfortable
Yes, I don't have problem with it's rarely to have any question or the patient does not allow. Usually they allow to eat.
Excellent. Thank you very much, Dr. Rabashofsky.
It's a great honor for me, and thank you for the opportunity.
It's been a pleasure speaking with you today. Thank you so much.